Hello, everyone. I'm Loanne Lake, and I'm here live in Charlotte, North Carolina at Friendship Missionary Baptist Church for Caring's second annual Maternal Health Conference. I have the honor of hosting the inaugural episode of Maternal Wellness Matters, a podcast powered by Caring. And it's an addition to this year's conference so that we get different perspectives from attendees, the organizers, and their supporters about the importance of maternal health. With us today is our CEO of Caring, Tchernavia Montgomery, who's going to tell us a little bit more about why this conference is so important to the community. Tchernavia, welcome.
Thank you. Thank you. We are hosting this conference, number one, because last year was just so energizing and let us know that we were moving in the right direction in regards to the message that we were trying to amplify in the community around maternal wellness and health. So this year's conference is doing the same thing. It's bringing together stakeholders, providers, those who are boots on the ground in this work that we're doing to share in the journey of learning and education and understanding where we need to focus our attentions as it relates to improving outcomes for maternal and infant outcomes in our community.
And you've had stellar support. I mean, the room was filled for all of the main sessions. You've got your breakouts happening now. And today's fireside chat with Congresswoman Adams and Mr. Charles Johnson was really energizing for the audience and all of us. What would you say has been the highlight of the day so far?
I think for me, it's the individual touches. So stopping to talk with someone in the hall, watching a room be electrified by information they're hearing or the experiences that they're having with one another. For me, it's about the collectivity. It's about just the communal solidarity that is felt in the room. It's hard to put it into words, the feeling, but it's something to remember. And it's really calling us all to action for the work that we have to do forward. So it's just the experience.
And you've mentioned calls to action. There have been several today. What would you want to see happen next after this conference? Having everyone informed and energized, what would you like to see happen next?
For them to take the information that they have here or relationships that they've built and use it forward, right? To find a way to apply it to your daily practice, find a way to make sure that it gets integrated into the work that you're doing. You know, we're talking about quality-driven work, evidence-based practices, innovation in the maternal health field, or research that may not be commonly known, but that is very key in driving the work that we're doing. So to use it, take what you have and use the feeling, right? This feeling that I spoke of that I think is communicable in a good way, that we're all sharing in, to use that energy forward. Sometimes, especially in the human services field, we get burned out, right? We have vicarious trauma. We have just things that we take on from those that we are serving, all with good intent, but it can sometimes feel very heavy. So we want people to take this and be invigorated and really reframe the problem and turn it into purpose.
Now, we've spoken with a variety of people today, from your sponsors to beneficiaries of your services to attendees and partners that are serving the community in many ways. What would you say to someone who is not familiar with Caring and how you can be of help to them, to someone who might not be in a position to have a primary care physician, but they are a good fit for your organization?
Absolutely. So we've been around since 1955. And this year, on our 70th anniversary, we are amplifying what we do more so than ever. We understand the need that is within our community. And every day, we're trying to find ways to both broaden how we serve and to deepen the work that we do with the individuals that trust us with their care. And we do not take that trust lightly. Our goal is to provide compassionate care, provide dignified care, and to make sure that our services are affordable and accessible, but also quality-driven. We spare nothing, that we are able to make sure that someone is receiving the care they deserve. We believe that health care is a human right. We want people to be healthy so that they have the ability to work, to live, to take care of their children, to be able to afford their housing, and to progress economically within our community. So we're a safe haven for those that may not know where to go. If we don't have a service that is best fit, we will find one to make sure that they are with one of our community partners that can meet that need.
And because of your holistic approach, I know that you recently opened up a food pantry. Can you
Yes.
tell us where your new facilities are and how people can get to your building?
Yeah, so we were thrilled to relocate back into a corridor of need in February. So we are now located at 1514 North Graham Street. And within that new space, which is double our square footage to accommodate the growth that we've experienced in recent years, is a client choice food pantry. We're partnering with Nourish Up and with the American Heart Association to provide 7 days worth of food to anyone in need. We had a food shelf before, and now we have a whole pantry with all the things that someone would need to fill their fridge and make sure that their families are not experiencing food insecurity, at least temporarily. So we're really excited about that added benefit to those that we serve and to anyone in the community. It is open to all.
Well, that is wonderful. I have two parting questions for you. What
Yes.
fuels you every day that makes you energized to do what you do?
Knowing that we're doing the work. I want to sleep good at night. I know there are problems that we cannot solve alone. And while that does disturb me, I feel wonderful working alongside the teammates that we have at Caring, our stakeholders, our partners, those that support us in our mission and vision and are aligned in strategy, knowing that we are digging our heels in, we are 10 toes down in this work, however we can be with what we have and the resources that we're given. So I am just really grateful to not be alone in this work forward. And I'm looking forward to whatever is next.
Awesome. And how can people find you digitally?
Yes, so we are on all social media platforms. Caring NC, so CareRing NC. So follow us on all the social media channels. Please find our website and find a way to volunteer. We have lots of opportunities, especially with our pantry. Our food pantry is a wonderful way to have corporate or group volunteerism. We are open on that pantry on Tuesdays and Thursdays and have our drop-off day on Monday. So a couple of hours of service goes a long way. And also, of course, funding. We are a nonprofit, so if you have it in your heart to be able to give to us fiscally, we will take any amount that you have to give because it all is going forward. 92 cents of every dollar goes toward programming with our organization. So we are acting very responsibly with every dollar we receive.
Well, we appreciate your work. And based on the statistics you shared today, the work is having an impact because the morbidity rates are going down.
Yeah.
So we thank you very much for your servant leadership, and we look forward to next year's conference.
Thank you so much.